Percussionaire presents an instructional video on the use and care of our home care unit, the Impulsator. This video will provide you with the basic knowledge needed to set up, operate, and care for your Impulsator. It is not intended as a replacement for the trained individual needed for initial setup of your home care unit.
Hello, I'm Dr. Forrest Bird, and I'd like to have a little fireside chat with you today. You know, when I was a young lad, we had a President Roosevelt, and he always had his fireside chats, and he was a pretty good communicator because he got his message across. And today I'm going to try to get my message across. We're going to be talking about the Percussionaire Impulsator. Percussionaire Corporation manufactures, distributes, and teaches a unit that I devised. I patented it, and I invented it, I guess, even before I patented it, obviously. And it's a device that I know a little bit about. And I'm talking both probably as a physician as well as an engineer, and I will try to take and convey some of the thought process that was behind the interpulmonary percussive therapeutic concept of mine and how it might help you. First of all, I will already assume that you do have obstructive pulmonary disease, and of course you have a secretion problem and other things that embarrass your daily activities. And of course the background and the principle of this therapy is to try to keep a clean lung for you. Now we might start and set the scenario here. Let's say we're at home now, and home setting, we're by the fireplace in your home or wherever you might be, and a home care technician or technologist or a therapist, whatever we might want to call them, has brought this unit into your home, and they're going to actually teach you how to effectively use it. One thing we must all remember: if you're utilizing any medical device and you're not getting the expected therapeutic results, then you want to summon somebody, because obviously you have not been taught properly, and or there's an outside chance you know that something's wrong with it. And we must always assume that everything physiological and physical can fail over time. Now this is the device, and the device is called an Impulsator, and what it does actually are three different things. First of all, it puts a high dense aerosol, a medicated aerosol, into your lung, and at the same time it kind of percusses or impulses your lung. Your lung is going to shake. You're going to feel the whole lung mobilize. So what it essentially is going to do is going to deliver this high density aerosol into the lung. It's going to hold those airways open so you get it way, way down out here into the periphery of the lung. And at the same time, it's going to take and it's going to, just like somebody doing this to you, it's going to get air behind your secretions, it's going to bring them up, it's going to raise them so that you can take and cough them up. One of the most dispensable things, you know, is a box of Kleenex that we want to always keep handy around.
Your Impulsator and accessories.
Now, let us look and see what we have. First of all, we have a unit. It's semi-portable. It's not too heavy. It's something that can be moved around. This allows you to transport it with you should you go out on a vacation, or you might be a student and you go from home to school and so on. All you need is conventional 115 60-cycle power in the United States. Now if you're overseas in many areas, you have 220-volt 50-cycle. But the device is the same. The only thing is the power requirement is different. Now inside this unit is a big air compressor. It's a 10,000-hour compressor between oval. It's a tremendous reliable. It puts out a lot of air, medical quality. It's clean air as it comes through the unit. And this will actually operate all of the various functions of the device. Now, in order to operate this device, we look in the back, we have a plug. And of course we plug that. We have a certain plug that we'll show you in a second. We have an on-off switch. But in the back, the most important thing right here is this label. You want to read this label and understand everything it states. Read this label, very, very important. And you notice it's Underwriters Laboratories approved and has other various approvals for various areas of the world. Now, in order to take and plug this in, you just don't use any plug. Everything we look at from a fail-safe and a safety point of view, especially something that you have in the home, of course, as well as the hospital. And Underwriters Laboratories are very, very strict on this. We have special plugs And this plug goes right in here. It'll only go in one way. You notice there's a prong. And the big hole, of course, goes over the prong. You push this in. Now the other end has 3 prongs also. Please do not use what's called a cheater. In other words, it's a device that will go over there that comes out with 2 prongs. Because if you do that, you lose the ground, and if something happened, you actually could get shot. Now there's certain accessories, and I'm going to show you everything that comes with this unit. And the first and most important thing that comes with the unit is your manual. This is an operating manual. It tells you exactly what to do. Everything is in here, all questions and answers, and just anything that any patient has ever asked us over the years. We've put in this. There's a lot of tremendous information, and it can be read and understand pretty easily. That manual is important, and make sure you have it. In fact, it's a Food and Drug Administration requirement that the manual and the labeling goes with the unit. And also, notice there's labeling on the front. You should read this and understand it. And of course, we're all sometimes, we can't remember everything exactly because a lot gets thrown at us in one time, especially when you come in the first time. That home care fellow comes in, the respiratory therapist, he's going to throw a lot at you. So this is going to back up what he says, and here's a nice picture on here that shows how this breathing head's going to go together. Now, this is a convenience. It's a little platform that we're going to put on here, and we're going to find that's going to be useful here in a little bit, actually, to take and put some of our accessories in, our breathing head when we want to rest and so on. Now this is called an interfacing tubing, and there's a short end and there's a long end. And now the next thing we're going to look at here, and I'm going to sit down briefly here as you would be the patient. Now let's look at what we have and get into here in breathing head. This is called a nebulizer. This is called a nebulizer right here. Notice it's got a button on it, and that button is your start button and a stop button. And normally we're going to look at 2 ways. I advocate just holding it down and just taking it continuously for your full period of time. Now, if we always kid and say if you want to come up for air, let off on it, and or if you have to expectorate, you got to cough, just let off on it and cough. And or if you want to rest a minute, let off on it and breathe the aerosol, this mist that you'll see in a few minutes to come out of here. Now this comes apart. It comes apart here like this. But what did you get in the breathing aids? We talked about your holder here. We've talked about your interfacing harness, the manual, all important, the nebulizer, and then we look over here and we bring this over. This is really important. This is called a phasotron. And this too comes apart. And especially we're going to clean it. We're going to learn how to clean it every time we get through. And this just comes apart here like this. Notice there's a spring in here. And this is called a venturi, and that's a phasotron because it phases right up here. There's a little diaphragm in the end. Normally you won't take that off. You rinse this, and you can wash it and so on, and of course the sterilization. There's a little O-ring on the end. Normally you will not take this off because if you take it off and you don't put it back on, it's going to go clack, clack, clack every time, and you know it's missing. But normally you won't take that apart. So this you just rinse as it is, or you sterilize somebody, and it won't go in backwards. You can't put it together backwards. It'll only go together one way. And then, of course, this cap goes in very, very easily. We bring it right on in, and there it is. So just finger tight. You don't have to tighten it up beyond that. That's called the phasotron, and again, this is the nebulizer. And we have another tubing. Now this tubing goes on, and we'll show you later, and all this does is pick up your exhale gases so that you won't sprinkle your clothing with medication and so on. Now, just before we put the medication in the nebulizer, let's go over what should come with the unit. First of all, we went over the power cord and the interfacing harness. We talked about your nebulizer here that comes with the unit. We talked about the phasotron and this red tubing. This is kind of important. We'll go over that in a minute. But there's a little bag of accessories that comes with the unit. And in here there's several things that are quite important. And really the mouthpiece is important because you need a mouthpiece. Now mouthpieces, there's 2 types. I like the round piece. Now if you're a French horn player or cornet player, you're not going to have any trouble. But puckering the mouth around this is important because cheek flapping is something that you have to learn to control the facial muscles. And each time that impulses or puts an oscillatory pressure or an impulse into the lung, you'll do that. So you'll soon learn to overcome that. And your round mouthpiece, you pucker with your lips around it. But let's assume you're an edentulous patient. In other words, you've got false teeth. And we have another mouthpiece for somebody like you that might be more comfortable, and this is called a flange mouthpiece. See, it's wide and it will actually fit right in the mouthpiece. But this is the one I advocate and I'd rather you do. Now the extra pieces, the mouthpiece and so on, your respiratory therapist, technician may not leave these with you because these are service O-rings and stuff, and maybe he feels he's going to do it or she's going to do it and so on. But in any event, this does come with the unit when it goes out. So if you are purchasing a unit outright and so on, make sure that that's there. But one of the important things in here, and I always seem to have trouble getting these bags open. Here I am. This is called a lube wick, and what this is silicone. It's a silicone, it won't hurt you in any way, and right in here we wipe this because this gets real tight. In other words, whenever we take and try a nebulizer and it's this way and we have to put it together, and you have to do that to get it apart. It needs a silicone wipe because it should go together, boom, just like that.
Review: impulsator, lube wick, interface harness, nebulizer bowl, convenience holder, manual, mouthpieces, phasotron, red corrugated tubing, power cord. How to set up your impulsator.
Now this is called an interfacing tubing, and there's a short end and there's a long end. An easy way to remember this, you know, in life I usually get the short end, you probably do too. Well, the short end is the one that interfaces. Here's the red one. Now when we push those in, all we do is put a little pressure and we rotate, and you hear it snap. Here again, I'll take it out, and it doesn't take too much to pull it out, about probably a 5 to 6 pound pull. And now, you notice as I put these in, I'm going to take and kind of rotate them, and you'll hear them snap. You kind of rotate them. They will rotate them, and we'll rotate them. All the colors match them. Now, if I did this, I'll guarantee it won't work worth a damn. It just plain won't do it unless you can match those colors and do it right. So if you ever have a problem, you know you haven't matched the colors, probably 90% of the time. Something's happened here in color matching. So remember, the short end goes up here, and this is the long end down here, called an interfacing harness. And this is going to bring everything up to your airway up here. There's one other thing I'd like to show you. Every once in a while, on this end, we're going to lubricate these ends right here. Lubricate these ends, because if you don't, a little O-ring on there that seals. Because remember, this is percussing all the time. These are aircraft fittings, actually. They're used in aircraft so they can't vibrate loose or anything like that. They're very, very precise fittings, and of course they'll last a long time, providing you keep them lubricated. I don't think you'd run your car without any oil in it. It's the same thing here. Just a little lubrication on this, and every once in a while when you find it to be a problem. Now the next thing, now we're going to take and put our medication in. We always speak of drops because I don't want you taking a metal needle and going in here because you'll destroy your medication. So usually you'll have a dropper bottle, or you'll have a glass dropper that you'll put in there. But this is better, a dropper bottle. And what we'll do actually is I'm going to drop the medication in here. There's 1, 2, 3, 4, 5, 6. If you put an extra one in for good luck, that's no big deal. You won't have to worry about that at all. It's not critical, 4 or 5. But try to stay there. And that represents about a half a cc of medication. So if you had a half a cc. And on this nebulizer, there's a scribe line right down here on the side somewhere. I'm having trouble seeing it from the side. But anyhow, it goes from 5 right up to 20. And oftentimes, if it's your unit, I'd put a little red fingernail polish or something there so that you see it. And or there's another way. We've got our medication in here now. Now we're going to always put 20 cc's of water. And here's a little 20 cc beaker that we have right down here. And most hospitals have these, but you probably won't have it at home. Now you can go over under the faucet if you want to. And let's talk about what water we put in here. First of all, if you go down and get a nice quart bottle of sterile water, and you use it once, when you open it and put it in, it's sterile once. Then you put it in the refrigerator and it lasts 2 months. Well, boy, I'll tell you, it's going to be crawling by the time it's 2 months old in that refrigerator, even a few days old. You have options. If you don't like your tap water, boil your water every day that you're going to take and put in here. And or usually the copper pipes with copper sulfate and so in the house. I've always used tap water in mine. So you have a choice of sterile water, or you might be using physiological saline if your physician prescribed that, and that'll be in little ampules, but that gets kind of expensive as sterile water in ampules. So let's say I'm going to take and put 20 cc's of water in here, and that will take and bring it right on up to my scribe line. That's exactly what I want, or where I put the fingernail polish on there for an index. Then I'm going to take and put my nebulizer together. And remember I said take and put it together in such a way that I'm going to come out here together. And you're going to feel actually a detent. Because if you don't get it together, it's going to fall apart and you're going to have your medication and everything all over the floor. So actually feel it detent. And now we're aimed in the same direction here. Now the next thing is we have our phasotron together. The phasotron's going to be in our left hand, in our thumb, providing we're not a southpaw, then all bets are off. Here we're going to put our right thumb right on here, and green to green. You see, we're going to match the two. See, green goes to green. And right here, and our thumb's on this. And we're going to sit in our chair, and we're always going to swing this so it points right toward our airway. And then we have our mouthpiece. And as I stated, I like the round mouthpiece because I think you do a little better job. Now we've got interface, and here's the long end. Remember the long end of the harness. You always want the long end of life, don't you? Now the red goes right on in here. Red goes in the end, and then the white, no trouble finding the white. The red and the white's pretty clear. Now we get over here, and this is green, and the green's going to snap right on in here. The green. We snap, and we hear it snap. Notice I'm kind of twisting it again so that we can see. Now yellow goes to yellow down here. I'm going to push it in and twist it a little bit. Now I'm all interfaced. There's one thing we haven't put on yet, and that is the red tubing. And the red tubing will go in one place. Now, here's a mistake that's sometimes made. I've seen actually patients do this, and they try to breathe through here. It happens. It happens. Now, here we are in this connection, and the mouthpiece always goes here in the end. And there's a picture right on here that shows just how to do it. And you're going to forget. You can swing these things around however you want. Usually I do that kind of to get it out of the way. Now I'm all set up and I'm ready to take my treatment.
Review. Connect short end of interface harness to unit. Snap and rotate. Fill nebulizer bowl with prescribed medication, placing top on with ports lined up properly. Make sure lid is on tight. Assemble phasotron, attach nebulizer to phasotron. Green to green. Choose proper mouthpiece. Connect long end of interfacing harness to breathing head assembly. Attach red corrugated tubing, red to red. Place inconvenience holder. Note, if at any time you notice resistance when placing nebulizer bowl together or connecting the harness, you need to lubricate O-rings. Your equipment will last longer with proper care. Taking a treatment.
It's important to get a very comfortable chair so that you can sit back and be comfortable. And I would advise you to take and put it so you can see a television receiver. And do something. You don't have to sit there and do this. You'll get so that you can read the morning newspaper while you take your treatment, or better yet, look at the news on television. Same way in the evening. In other words, don't sit there not doing anything because time goes so slow. You know, if you're busy, boy, or looking at a movie or something, time goes fast. And you'll be taking your treatment, and you'll automatically take it once you learn to do it. So consequently, here's another thing I don't want you to do. In other words, I don't want you to go way over like this, because if you go over like that, what happens? Your abdomen will push up in the diaphragm and it will actually decrease the amount of air you can get in the lung. So we want you relaxed. In other words, be comfortable, because this is going to do the work of breathing for you. You don't have to do the work. Now I'm all set up and I'm ready to take my treatment. And I'm going to turn the unit on. But before I turn the unit on, I'm going right over here and I'm going to make sure that this black arrow is under the white arrow on the top. And I'm going to make sure this is turned all the way over here. This is my first treatment now. I've never taken a treatment before. And I'm going to come down here and I'm going to turn this, loosen that white ring, and I'm going to turn it over till it won't go any further. Now, when we're ready to start our therapy, we come over here in the back. And remember, there's a toggle switch. And we switch it on, and we sing the mist coming out of here. And you can actually see the mist. Now, when I push down on this button, You see it pulse, the mist all but disappears, doesn't it here? See? It just about disappears. Now, this is a starting point and a starting point only. Because if we look at our pressure down here now, we're down below 20 pounds. And that's not a therapeutic operating pressure. In fact, we don't have very much mist coming out of here, really, from what we should have. But it's a starting point. If we're initiating, we've never used it before, maybe we've got a patient with a hyperactive gag reflex. But this is a good start. So first, of course, I can't talk and put it in my mouth. One way to shut somebody out. You know, your husband or your wife will probably, if the other way around, will say, put the damn thing in your mouth. You say all the way along. Just remember that. So I get hushed up here too. So I'll come back and forth and do the talking. Now, I'm going to breathe this mist, and it feels cool because we've got evaporative cooling in here. So we hold it up here like this. You notice when I breathe in, I get it, don't I? Now I'm going to start pushing the button down. You see a little shaking, but really not enough to do any good. But that gets us used to what it's going to do. So again, watch me here now. See, my thumb's pushing down on this button right over here, and when it does, it starts pulsing, see? And I breathe in and out, just in and out of the mouth. I think of this as a soda straw. The problem is we don't want to let that air out our nose. We're going to make a scuba diver out of you yet, or a French horn player or something here, see? I'm breathing in and out of my mouth and not my nose. Now, about this point I come down, and there's a knob down here, remember? This little knob, I'm going to turn it, and I'm going to get it up to about 30 pounds or thereabouts. And it turns a long ways. So I'm turning, and there, I'm up to about 30 pounds now. Now you see our mist is still coming out of here. And I'm going to put this in my mouth now. And now it's kind of spanking my lungs just a little bit, and you can see a little more activity here. Now I'm just going to take a deep breath when I feel like it, and I'm going to exhale. And the important thing, watch when I exhale down through this. Watch what happens. You see, my chest shakes more when I exhale. And that's important because that just milks all those secretions on up out of the lung. That's why we hold it down and we breathe through it. We used to teach to begin with this way. And then let off and exhale. But that was an error because when you breathe back against that pulse, it actually milks those secretions right up out of your lung. Which again, let me show you. Now, we've got things kind of rattling around and so on. Now I'm going to take, and I'm going to bring my pressure up a little more here. I'm coming up to about 35 pounds. Still over here on easy. Now you notice the percussion's just a little sharper. Now it's really starting to shake me up a little better down here. And you probably work between 30 and 40 pounds. Now I'm going to bring it right up to 40 pounds here now. See the mist come out of that tube? And you get a little wet. Sometimes you might want to put an apron on or something. But usually there's not that much, especially after you learn to use it a little bit. But now the important thing is, now I'm going back down with my pressure down here to about 30. I just wanted to bring it up and show you. That's 30 pounds. Now, let's see what I can do with 30 pounds. Now, this knob. Now I'm going to bring this knob up gradually toward clockwise. In other words, We go by a clock face on here, and that's 12 o'clock. That's going to be 9 o'clock. Come around about 9 o'clock here, and let's see what happens. Now it's pulsing a little slower and a little harder for me. It's actually pulsing a little slower and a little harder. And I get used to it here. Here's what you don't want to do. Now watch my cheeks. We don't want to do that. We want to let it go down. If you have trouble doing that, breathe in. When we start breathing in or we relax and let it go down, we don't see our cheeks puffing like that, do we? Now, let's say we come up here to 12 o'clock, straight up. And this is where we're going to work a good part of the time. You know, that's a pretty good program we got on television over there. But I got to keep my mind on this a little bit until I get used to using it. Okay? If I don't, I'm going to start doing this and so on. Hey, that's more interesting than this. But first learn how to do this. You know, already know how to watch television. Now, you know, I'm getting kind of sloppy here. I don't think your respiratory therapist is going to give you this. But always have Kleenex in the house to wipe your bib and tucker here, see? Very important, especially when you start coughing. You're going to need something to cough these secretions up into. Okay? Now, I like that pretty well. Now I'm going to come up to 40 here, but whenever I raise my pressure, I'm always going to go over to easy. Now it's spanking my lungs a little better here. In other words, it's oscillating my lungs, it's impulsing my lungs, whatever I want to call it, percussing my lungs. Lots of different terms. Now, that feels good. I feel that percussion. And if somebody's looking, and you usually can't feel it, but you're going to put your hand down there. Now watch, I'm going to percuss again and I'm going to put my hand. Kind of watch my hand. And if you can't feel that percussion way down here, you're letting it out your nose, you're letting it out your mouth, or something. Now, let's say I come down here a little more. Now, let's say I go along, I'm starting to get a little tired, because I'm just starting to learn to use this thing. And I can't hold that pressure. In other words, it's coming out my mouth. What I do, go back toward easy again. And now I'll learn to accommodate there. And again, this thing can get pretty juicy because that's putting that in your lung. That's real great. You know, some time back, I was out with a boy. He had cystic fibrosis. And I had taught him how to use this, I guess, several years earlier. He says, Dr. Bird, do you know how to blow smoke rings with this thing? I said, no, what do you mean blow smoke rings with this thing? And he says, well, let me show you. Let's see if I can duplicate what he did. Now, you don't want to spend all your time blowing smoke rings with this thing. See? Well, I'm not an expert, but I'll tell you, he sure was. But as I say, to break up the boredom when you're breathing that mist or something up here, that's something to do. Just hold it up here. You're breathing your mist. Well, I can't get perfect ones. He did. But in any event, what we do is we continue on. We go through this a full 15 minutes, and we continue with our therapy. Now, when you're not pulsing, you want to breathe this mist. And the medication you put in there will last about 15 to 20 minutes. And that's you want to go a full 15 to 20 minutes. Don't cut yourself up short. So it's either go till your medication's gone, you got an interesting program to watch over there now on your TV, or boy, that morning news, my golly, something else happened out here that's important. Okay? So we go ahead. We can't overdo it. I think that's the thing I want to make. Now, at a certain point in time, we're going to have secretions come up. So always have that Kleenex ready. And do that. And then, of course, go back for some more. Because you'll keep working these secretions. Now, when you're through your secretions, they're going to be coming up for the next half hour. You're going to get a lot of them that way. You're going to swallow them. And then sometimes you're going to cough pretty hard. Pretty hard. Now, as far as hurting the lung with this, I don't know of any lungs we've really hurt. They're it's a stable situation all the way along the line. And always start over here on easy. Now a cough, that's 150 millimeters of mercury. That's a hard cough. And the most you're going to get with this is maybe 30, 40 centimeters of water pressure. So if you ever have any problem, it's going to be a hard cough. But you have a productive cough, it's not a hard cough. And this is a tremendous unit. You're going to find out it's going to be a darn good friend. Now, again, let's review the difference between this knob down here and this percussion knob. This is the operating pressure gauge down here. Now, the higher the pressure, the harder it's going to spank your lungs. In other words, the harder it's going to oscillate as far as your lung is concerned, or pulse your lungs. Again, whatever term you want to use. So this is the ability. This is the sharpness of percussion. And this actually is the ease of percussion over here. If we go all the way counterclockwise, that is a very rapid, it's just like a tack hammer doing this. And as we gradually slow this down, it's going to hit your chest a little harder and a little harder. The impulse is going to be harder. And let me show you that now again. I picked a pressure now of 30 pounds. And I'll show you what we do with 30 pounds. Very easy here. Watch my chest now as I slow this down. See, in other words, it's how hard it shakes my chest. I go over on easy. Now, sure, it might be nice to leave it on easy all the time, and you'll hear all these secretions rattling around down there, but you're not going to get them up. So unless you take and mobilize the secretions first, with this over on easy or over here at 9 o'clock or wherever you might want to be at whatever pressure you've selected, the secretions are going to stay there. So until we come over here more and hit that lung harder, we're not going to raise these secretions. We're not going to get them up so we can spit them out. Now let's say I didn't get secretions here. Now I'm going to go over on easy again with percussion, and I'm going to come down here and I'm going to raise my operating pressure up to 40 pounds. Now I'm going to start in over again. That got it. See, in other words, that starts mobilizing my secretions. Well, you're not going to take and mobilize your secretions unless you really slow it down. But let's say I still didn't get it. I'm a big old rascal now. And I brought it down here. Now I'm going down, I'm going to go up to 50 pounds. And this might happen. You've got real sticky Civil War, pre-Civil War secretions now. Boy, they've been down there a long time. And you want to bring them up. So now I'm going to get the mule kick here. So I start again over here on easy. That's the Chinese chop, I guess we call it that. Eh? In other words, that's going to get secretions if they're down there. But normally you'll probably work, anywhere from 30 to 40 probably, depending upon what you feel like. But you can start easy. And the biggest thing, if your pressure is too high down here, and this is too high, you're not going to be able to hold your lips around. Your chest's not going to move right. Remember, if that chest doesn't move, we say bilateral, which means both sides. So you got to have both sides of your chest moving. You know, some people kid it's like rubbing your belly, you know, and patting your head at the same time when you start to use this. But within very, very few treatments, you'll learn to use it well. And remember this manual. In other words, the more you use it, the more you read that manual, and the better you'll understand it. Because, again, as I say, this is going to be a tremendous good friend. So now we've pretty well been through this unit, and it gives you a pretty good idea. I haven't covered all the highlights, but I think I've covered enough of it to make you realize how you're going to use it and when you're going to use it. And remember, you can't use it too much. And if you're a home care patient, in the morning when you first get up, very, very important. And then, of course, you use it before you go to bed at night. Now, if you're home at lunchtime, use it then. But, you know, we all get infections. And we have almost a liter of these tracheobronchial secretions manufactured in our lungs every day. And if those secretions don't normally come up as they should, they get viscid, they get sticky, and they stay in your lung. Every bug that goes by here, called pathogenic organisms, we breathe in, and all around us. Or your friend just brought his cold over and gave it to you. And you went by and you breathed it in. Now, if that nice, warm, high-protein culture medium, we call it a garden, stays down there because you retain these secretions, your friend gave you his bug and it goes down there, and you've got an infection. Only he doesn't have obstructive pulmonary disease. He's not a cystic. He doesn't have emphysema. He doesn't have asthma, all these good things all the way through. So he just has a normal cold. But now you start this and the secretions get sticky. They plug up what we call that ciliary escalator, the street sweepers of the lung that normally bring these secretions up. And boy, you got an infection, you can damn well end up in the hospital with pneumonia, can't you? But with this at home, you can do essentially everything they can do in the hospital. In other words, you take your treatments more often. Get that culture medium up out of the lung. Get that garden out of there. Sure, you're going to have a cold, but it'll be mild, just like your friend if you get rid of those secretions. Now, obviously, if you get a severe infection, you're really in trouble. Make darn sure you call your doctor. But in the meantime, so many of these transient infections that are so severe to you and they don't affect your friend very much, you can do very well. You can take this every hour if you need be. Or if we had you in the hospital, we'd use the intensive care version of that, intensive volumetric diffusive ventilation or respiration. All of these are various levels, so you can't overdo it. I guess that's what I'm going to say. Use it as you need to. You'll find, again, it'll be a wonderful friend. I thank you.
Review. Comfortable chair with armrests. Calibration knob, always at 12 o'clock position. Percussion knob, counterclockwise on easy to start. Pressure regulator knob, full counterclockwise. Turn unit on, back of unit. Adjust PSI, 20 to 25 PSI to start. Make sure aerosol is misting from mouthpiece. Place mouthpiece into mouth, forming a tight seal. Adjust nebulizer for a comfortable position. Activate remote thumb button. Percussion should start. Inhale and exhale through percussions. Breaks between percussions should be as often as necessary to cough or rest. If resting, continue to breathe aerosol. Work through full range of percussion, easy to hard, before increasing PSI. PSI should be adjusted for comfort and to help raise secretions. Always start with percussion knob on easy. Adjust PSI in 2 to 5 increments. Treatment should last 15 to 20 minutes. Turn unit off. Disassemble and clean.
Now when you get through taking a treatment, you're going to turn this rascal off back here, and you're going to take and you're going to disconnect it. So we come around here and we kind of twist and we pull. Kind of twist and we pull. We do this. Now this one over here is a little different. We don't want to take and do this out here. Take and get a hold of this kind of and just pull off like this. Let me show you again. Don't do that with it. That's not, it'll come off of there, but you put kind of a strain on it. Take and come down here and do this. Just actually pull this off. Now this is free. And what are we going to do with this? We're going to take and we're going over to the sink, and we're going to take and mechanically wash it, rinse it, and clean it, and let it dry on a Turkish towel and so on, which we'll show you. In other words, we'll show you all of this. Now, after we've completed our treatment, we disconnected the breathing head. This is called a breathing head assembly. And we're going to mechanically rinse it. First of all, we're going to take it apart. We're going to take this red tubing off. We're going to drop it down in the sink. We're going to take our phasotron off and drop it down here. And we're going to take our nebulizer apart like that and dump it. Now we're going to take our phasotron apart. And this is important to take it apart because, you know, lots of times people don't do it. Take it down to there. And also, I like to take the mouthpiece out of here. Now, a mechanical wash, as the name implies, it's just a rinse, isn't it? So we take and rinse this pretty good like this and get it all the way through. And over here on the side, of course, we got usually a towel, Turkish towel or a dish towel. And I usually put a piece of on top. Now here's the nebulizer barrel. Now there's something that I'm going to do here. Actually, if we got this down through, you see right now that's going to leak out of here. In fact, it would leak. So after we get the water out and we've rinsed it, always do this. See what I'm doing? Because if you don't, you're going to put your medication in, it's going to run right back out of here. And that's a special anti-siphon effect that's built into it so that you couldn't get any sterilization agent in your lung if you didn't do this. So always take and do that, or it'll self-flush. And then, of course, you put it over here. The top of your nebulizer, just rinse every port all the way through with it. And again, just shake it a little bit and go over and try to position it over here so that it drains. Here again, the Venturi assembly, good rinse, mechanical rinse, lukewarm water is fine. And just take and do everything. Now if you don't and use epinephrine or some of these medications, these will start getting brown and so on. Now this one here, what I do is I fill this up. Just fill it right on up until it finally will take and drain out. So I drain it out. Now, you can stretch this. You can stretch it out like this. Now, what I usually do is take and whirligig it. You know, if you stand in the room and you whirligig it, sometimes you get water all over your ceiling and everything. So, in other words, if you kind of do that, that'll dry out. Now, you put it here, and usually the biggest important thing in any of these things, it'll let it dry. Now, sure, if you have to take a treatment every hour or so, it may not be. Now, really, in reality, you can put this in the average dishwasher once in a while, but you're not going to be firing up your dishwasher every 15 minutes. So maybe once a week or so, if you want to take and put it in the dishwasher when you run your other stuff, it won't really hurt anything. But sterilization is something I pay a lot of attention to. And you know, there's wonderful agents, there's all kinds of aseptic procedures that you can pay a lot of money for out there. They've been around for years and years. And everyone has their own ideas. But at home, sometimes you're just not going to have everything. But things you're going to have at home, everybody's got some bleach at home. For institutional use or whatever, Clorox, Purox, I guess there's all kinds of them, all patented and so on. And it tells you in the back. In other words, there's for disinfecting and so on. Well, that's in Spanish. I think we better get over here. I read English better. For sanitizing, for disinfecting, just take and follow, really, the mixture it says. And make enough so that usually a gallon or so. And you have a pan. And you just put all of this stuff maybe once every other week with Clorox or Purex, sodium hypochlorite. And that'll get a whole family of bugs and organisms that you wouldn't want. Now, alternately, for the other week, I take white vinegar. And that's the acetic acid in here is what's important. And I take 1 cup. In other words, I just take a cupful of this and put it in a gallon of lukewarm water, and I let it soak in there for maybe 15 minutes or so on, and then of course I take it out and rinse it and put it over and let it dry. And that's a very, very simple and pretty effective means of actually sterilizing. Now, when we put this back together, remember, we want both of these to face the same way. And there's lots of different positions on it. That would be wrong. This is facing this way and so on. So bring it around so that we take and face it in the same direction. And that's really all we have to know about that. And sterilization, as I say, you alternate, in my opinion, for simplicity at home, every other week. 1 week with acetic acid, which is white vinegar, a cup to a gallon, and then just follow your U.S. Public Health Service suggestions or whatever they do as far as sterilization with the sodium hypochlorite, which comes into lots of labels. That's your bleach that you use. Very, very effective. Very effective. And that's about it. And again, as I say, try to dry it. You can put it in the dishwasher once in a while if you want to. I don't think there's much in there that will hurt you. Thank you very, very much.
Review. Disconnect long end of harness from breathing head. Take breathing head to cleaning area and disassemble. Take apart nebulizer and phasotron. Rinse between each treatment and mechanically wash with soap and water each day. May be placed in dishwasher. Shake out any excess water or cleaning solution that may be left in the bottom of nebulizer cup. Sterilize once a week using an agent recommended by your home care company.